I'm Professor Yang Seung-min. Ideal implant means hard and soft tissue is properly treated and they should be accompanied with functional and aesthetic prosthesis. Proper treatment of hard and soft tissue is important for long-term stability of an implant and for aesthetic functions as well. In this lecture, we will take a look at soft tissue preservation after extraction. Today, I'm going to talk about these contents in this order. First, determination of surgical technique for soft tissue augmentation, hard tissue changes after extraction, soft tissue changes after extraction, how to overcome the changes after extraction, and summary. Determination of surgical procedure. It can be classified depending on the width of keratinized gingiva, whether the width is 5 millimeters or higher or less than that. We can use different procedures depending on the width of keratinized gingiva. Generally, after extraction, the width of a natural tooth after extraction is quite different from the width of the tooth after healing. The difference can be attributed to the changes in the residual keratinized gingiva in each case. Thus, in order to apply a certain procedure, we need to understand the changes after extraction. If you look at here at number 37, there's a severe bone loss, so the tooth is to be extracted. The width of a natural tooth, it's about 9 millimeters. In the case of mandibular posterior region, the width of lingual and the buccal gingiva has been maintained. This is after extraction, and this is after healing. The reduction of the tissue happens in the anterior region as well, just like in the posterior region. Before extraction, you can see quite thick, rich width, but after the extraction, it is reduced quite considerably. The changes seem to be soft tissue changes outwardly, but hard tissue inside also changes. Therefore, after extraction, hard tissue and soft tissue change. How do they change after extraction? We can estimate what happens after extraction. Blood clots will fill the socket within 48 to 72 hours after extraction. Blood clots turn into granulation tissue. At about 4 days or a week post-op, slowly inside is changed. Osteoid begins to appear in the apical area around the week post-op. That is progressing gradually. In about 3 to 6 weeks' time, osteoids would be mineralized and the above granulation tissue would be turned into connective tissue, and at the top, epithelialization would be progressing. At week 6, bone is turning into woven bone, and over time, the hard and soft tissues would become stabilized. Inside, bone is formed toward the center. This is the change after tooth extraction. This is a process of healing. According to the healing, soft tissue and hard tissues change. And let's have a look at the change of hard tissue. Hard tissue, as you can see, when natural teeth are remaining versus no natural teeth remaining. If you look at the thickness of alveolar crest, there are differences over time that is amplified, and that happens depending on the healing period after extraction. Likewise, maxillary anterior and posterior region, you can see the changes between where natural tooth remaining versus not remaining. Such changes have been investigated by many. Depending on healing period, there are some differences, but vertical change is about 1 millimeter, and there are many differences in terms of horizontal change. The change ranges from 2 millimeters to 7 millimeters, so we cannot say the definite number for the change. Investigations continued. And if you look at here, vertical reduction, vertical change happens according to investigators. Buccal, mesial, and distal changes have been investigated. It's about 1.2 millimeters on buccal, 1.8 millimeter on mesial, and 0.8 millimeter distal side. Horizontal changes are varied, but in general this is much bigger than the vertical change. Depending on investigators and causes of extraction, it varies, but in general the horizontal dimensional reduction is about 3.8 millimeters in the first month after extraction. Within 4 weeks after extraction, 1/3 of buccal plate change occurs. Horizontal bone resorption is bigger than the vertical bone resorption. When an implant is placed, if the position of the implant is based on bone position, it tends to be placed lingually, palatally. So the future prosthesis position would not be very good. Therefore, you need to understand this. In order to have good prosthesis, you need to consider prosthesis before you determine the position of an implant. Maxillary ridge changes after tooth extraction in the anterior and posterior regions. As you can see in the figures, maxillary anterior region compared to posterior region, horizontal bone resorption is bigger and the vertical bone resorption is similar. So this is the change. So if you look at how they change, there is some difference between anterior and posterior regions. Unlike what we expect, in the posterior region, where the width of the ridge is wide, the resorption rate is bigger in absolute terms. However, it looks less resorbed. The labial bone ridge is very thin in the anterior region, so it looks that in the anterior region, bone is more resorbed, but in absolute terms, more bone resorption occurs in the posterior region. Likewise, similar outcome or result in the mandible. In the posterior region of a mandible, a vertical resorption also occurs a lot. Overall, it is similar to maxilla. So horizontal and vertical bone resorption occurs in the mandible. Hard tissue changes first, and soft tissue change follows the hard tissue change. Soft tissue and hard tissue do not change in different directions, but in the same direction. After extraction here, buccal resorption happened quite a lot. Then Soft tissue. The characterized gingiva zone is reduced quite a lot. Changes after extraction. Soft tissue, hard tissue changes go in the same direction. So hard tissue change can predict the changes that will occur in the soft tissue. So let's have a look at it. Soft tissue, as I said before, changes following hard tissue. And it is difficult how much soft tissue change occurs, but investigators studied this. After extraction, soft tissue changes occur like this. Buccally and lingually, after extraction, keratinized gingiva width shows some differences. In terms of soft tissue thickness, it was 2.4 millimeters labially and 1 millimeter lingually, but 6 months after extraction, they increased about 0.5 millimeter, so the thickness increased. After extraction, the thickness increased. That means after opening a flap, 0.5 millimeter of bone loss occurs. Soft tissue is compensating for the bone loss. One more important thing, the thickness of soft tissue on the occlusal surface, where we plan to place an implant. The thickness is about 2.1 millimeters. After 6 months, what does that mean? In another lecture, I talked about biologic width dimension around an implant. When it comes to an implant, biologic width is about 3.5 to 4 millimeters in thickness. After extraction, the thickness on the occlusal surface is 2.1 millimeters. When an implant is placed, the biologic width, in order to make it thicker, some changes occur. So this should be understood when you place an implant. Also, overall, from mucogingival junction to free gingival margin, how much changes will occur? We looked at the changes in the thickness, but we need to look at the changes in the width as well. So, in terms of width, at about 4 months, width increases by about 1 millimeter around an implant. In the space after extraction, it's 9 millimeters in the molar area. Not all 9 millimeters turn into keratinized gingiva. It is resorbed, and the increase is about 1 millimeter. It can vary as median can be changed. However, we can say there is about 1 millimeter change that occurs. What's the meaning of preservation in terms of hard tissue and soft tissue? The importance of keratinized gingiva was explained in another lecture, and that facilitates oral hygiene. What about the meaning of preservation when it comes to hard tissue? It becomes easier to place an implant, and no additional GBR is required. So we need to look at all of these together. So we need to preserve hard tissue and soft tissue as much as possible. We have to preserve them after extraction. If you look at here, the thickness of gingiva around implants, how much is sufficient? According to studies, occlusally 2.1 millimeters, 6 months post-op, around 2 millimeters. So we need to consider that when we place an implant. We should not interfere with the stability of soft tissue when we place an implant. Regarding a biologic width, let's review. Here we look at how biologic width changes under function of implants over time, early healing, short-term loading, and longer-term loading. In most cases, they have consistent thickness that's around 3 millimeters. The thickness includes the sulcus. The thickness is around 3 millimeters. Then, when we place an implant, occlusal thickness after healing is around 2 millimeters. Then, what can we say? 0.5 millimeter resorption occurs when a flap is raised and closed, and that is covered by the soft tissue increase, as I said before. If you calculate based on that, if you place an implant on the crest, 2.5 millimeters of soft tissue dimension is calculated, which is 0.5 millimeter deficient. And how can we secure 0.5 millimeter when we place an implant? In thin tissue, what does that mean? So I searched 2 millimeters are the criteria. If the tissue is thicker or thinner, if an implant is placed equicrystal compared to thick tissue, thin tissue side results in more bone loss. So in placing implants, the height of the remaining gingiva plays an important role. In order to overcome the situation, modifications are made. If you look at the thickness changes after extraction in general, how much changes occur? It's about 2 to 3 millimeters. The changes in the thickness, in some area 3 millimeters, in some 2 millimeters. So there is a variation between investigators, and you need to look at this. So thicker soft tissue gives more stabilization. So if you look at the summary made by an investigator, thickness of soft tissue measured using various methods, and considering the concave area, what graft material is used and how it's healed, there are differences. And the differences, as you can see in the figure, it's about 0.9 millimeters. As one is 3 millimeters and the other one around 2.1 millimeters. 0.9 millimeter difference. You need to consider that in choosing graft materials when you make a decision. This will help. How to overcome the changes after extraction? We talked about thickness of tissue and how to control the depth and socket preservation. Generally, what do you think is used commonly? It's the control of placement depth, but sometimes we cannot control that. Then socket preservation and other methods can be used as an extension to this. This is another paper. Soft tissue thickness, to increase the thickness at the implant site. Soft tissue preservation is made and the bone loss occurred less in that site. So what is most important thing is that when the thickness is thick, bone loss occurs less, and when the soft tissue is augmented, it resulted in less bone resorption. Regarding the procedure, the investigator placed implants rather deep instead of doing grafting. So when the tissue is thin, by placing implants deep, you can reduce the bone resorption. Grafting can be done, but implants can be placed rather deep. Clinically, this is a good way to reduce bone loss. Lastly, when we cannot place implants deep, before we place implants, socket preservation can be done. After extracting a tooth where hardly any buccal bone is expected, the inside is completely cleaned and socket preservation is done. After the height is maintained on the buccal side to a certain degree and that's healed, the soft tissue became thicker and the height is maintained. If you look at the tissue, soft tissue and its height is maintained and an implant is placed before finishing it. We need to understand the changes after extraction to maintain soft and hard tissue. That's the first step. How to overcome the change after extraction. As I said before, the thickness of soft tissue influences bone loss, and there are ways to overcome it. And clinicians need to make a decision and apply the technique. From an implant perspective, socket preservation is a favorable procedure to maintain soft tissue and hard tissue. So it is far better to use socket preservation compared to not using socket preservation. To maintain hard and soft tissues, changes after extraction are very dynamic response where soft and hard tissues move in the same direction. We need to diligently practice and prepare to maintain soft and hard tissues. If we fail once, very poor environment can happen, putting a lot of stress on the patients as well. We need to understand the response of the body after extraction. I hope you enjoy satisfactory results. Thank you for your listening.